All right, everyone. Thanks to the few of you that are logged on for this week. It is session 8 of 9, so we're getting close to the end. Today's topic is quality assurance. Lauren Langley is going to lead us today. I've said this every week. These are really important because a lot of times when we have to do tiebreakers, it comes down to quality assurance scores. And so there's usually a huge range in our quality assurance. So be sure to pay attention, ask all the questions that you could come up with, and be really engaged because you can make up some pretty big scores. So I'm going to turn it over to Lauren.
Okay, thank you so much, Rachel. So I am very excited to talk to y'all about quality assurance today. And just to kind of let you know what we're going to be doing, I'm going to do a short PowerPoint to kind of hit the highlights of what you need to know in quality assurance. And I've also got a few tools that I'm going to show that kind of go along with quality assurance. And then I have been doing beef quality assurance videos for extension for beef producers, but they tie in really well, to the topic today. So I'm going to show y'all one of those videos on given injections. And then we're going to round out the practice with a Kahoot. So if you have another device that can get on Wi-Fi, like an iPad or a phone or something like that, you want to go ahead and grab that so you can participate in the Kahoot at the end. But if you don't have another device, you can just play along and answer them in your head as we go along. Are there any questions to start with that anybody you just need to know right off the bat? Okay, feel free to put any questions in the chat window, and I'll definitely be checking that, and we'll have time hopefully at the end to go over any questions that you have. Okay, so you should be seeing the quality assurance PowerPoint. Okay, so can you give me a thumbs up if you're seeing the PowerPoint? Okay, awesome. All right, so here's kind of what we're going to look at. We're going to look at feed and medication labels. We're going to talk about livestock health, record keeping with some ear notching, and then administering injections. Okay, so for quality assurance, you definitely need to understand how to read these labels. So whether it is a medication label, a vaccine label, a feed label, you need to understand what is on these labels, how to read it, how to answer questions about it. So there's two types of feed. You have complete feeds, and then you have feed supplements. And kind of the things that are going to be, or the types of things that are going to be on a feed label, you're going to find the brand or trade name and the product name, the statement of intended purpose, the guaranteed analysis. They do guarantee that you're going to get X amount of protein, X amount of fat, minerals, things like that. The feed ingredients, the feeding directions, warnings or cautions. This is really important. Especially if you have multiple species on your farm. Some things can be fed to cattle, for instance, and cannot be fed to sheep or cannot be fed to horses. And some things are deadly. So you definitely want to make sure you understand the warnings or cautions. The drug ingredients, the name and address of the manufacturer, distributor, and the net weight. So let's take a look at all those things I just talked about and where they're kind of located on a feed label. So up at the top, you're going to find some really important information. You're going to get, the brand name's usually up at the very top. And then you're going to get the product names. This is called a sweet club calf finisher. And then if it is medicated, it will be right underneath the product name. So this is the medicated statement. And it is for feedlot cattle. So the statement of purpose says for improvement of feed efficiency and reduction in liver abscesses caused by, I can't even begin to pronounce that right now, and beef cattle fed in confinement for slaughter. So that's really important. You need to know what it is to be fed to, what the intended purpose is of that feed. Then you've got the drug ingredients and concentration if it is medicated. So right here you can see it has monensin in it, tylosin in it, and how much is in there. This is the guaranteed analysis. So crude protein, for example, they're going to guarantee 12.5%. And then it goes down all the way through your vitamins. Your feed ingredients, what you find first, what is listed first on the ingredients is going to be what is found most in that feed, all the way down to the smallest amount that's in that feed. So rolled barley. So this feed has rolled barley, rolled corn, cane molasses, limestone, then it goes from there. So it's mainly a barley and corn based feed. And then the cane molasses is usually added for like palatability and kind of hold the feed together. And then it's going to have all these different mineral component with it as well, and vitamins. And that's kind of what makes it a complete feed, is that it has everything in it. The feeding directions, so this one's designed to be fed at least 10% hay, but can be fed from 3 to 22 pounds per head per day with free choice hay, depending on desired rate of gain. And it goes through a whole bunch of other things. You know, you always need to have fresh, clean water available. You always need to transition from a forage. If animals are on forage only and you want to introduce grain, you've got to introduce it at a slow rate. You want to do it at least over like a 7-day period, and it talks about that. Warnings or cautions: do not allow horses, other equines, access to the feed containing monensin. So it has been proven to be fatal. Do not feed to sheep due to copper content. So the two examples I had talked about earlier, you'll typically find that, especially on medicated cattle feed. But any feed that has quite a bit of copper in it is going to have a sheep caution, so you need to look at that. The manufacturer, so the name and address of the manufacturer is down here at the bottom, and then the net weight. So like I say, everything, it usually kind of flows like that on a feed label. Okay, so switching gears from feed to medication, what you're going to find on a medication label is the name of the drug, the active ingredient, any cautions or warnings, the withholding or withdrawal time. So that's important for meat animals, because if you are giving them any kind of medication or vaccine or dewormer, things that have a withdrawal time, that's the amount of time it takes for that product to leave the animal system so they can be processed. So you definitely need to know that and keep good records of that, so that that animal has passed that withdrawal time before they are sold or processed or anything like that. So storage, it'll talk about, does it need to be put in the refrigerator? Can it be room temperature? Quantity of contents, approved use and species, the dosage or route of administration. So is it, you know, intramuscular or is it subcutaneous? So it's going to tell you that, and the dosage amount, the name of the distributor, and the expiration date and lot number. This is super important. You do not want to administer any of these products if they're out of date. You always want to record the expiration date and the lot number if an animal has an adverse reaction. You need to be able to call that company and say, you know, I gave a subcutaneous shot on the right side of the neck for my heifer, and you know, here's the expiration date, the lot number. You know, she you know, developed a fever and you know, this and this. You need to be able to have all those records to be able to call them up and tell them, just in case it was due to that vaccine you gave or something like that. Okay, so let's look at the label. This is Nuflor Gold, just to kind of give you an idea. So that is going to be the name, and then the active ingredient that's in there. Okay, and then when you're looking at this, the intended use. So for subcutaneous use in beef and non-lactating dairy cattle only, not for use in female dairy cattle 20 months of age or older, and calves to be processed for veal. There is a caution: federal law restricts this drug to use by or on the order of a licensed veterinarian. So this is not something you can go get at your southern states. You do have to have a vet client patient relationship in order to get this product to be able to treat your animal. There are residue warnings. Okay, so again, this is where your withdrawal time information is found. So animals intended for human consumption must not be slaughtered within 44 days of treatment. And then it goes on to talk about the issue with the dairy cattle and that do not use in calves to be processed for veal. The storage information. So it needs to be stored between 36 to 86 degrees Fahrenheit. So refrigeration is not required. You do have to use it within 28 days of the first use. Even if the expiration date's not up, certain products, once you pull the first shot out of it and you have broke through the cap, it does have time is ticking on that, and it'll tell you how quickly you need to use it. The solution's light yellow to straw colored, just so you are aware of the coloring. And then the description for it and how much of the drug it contains. And what the indication is. What is it used to treat? So it's indicated for the treatment of bovine respiratory disease, BRD, associated with these type of strains, and it's in beef and not lactating dairy cattle. The dosage and administration. So it is, you want to inject it subcutaneous at a dose rate of 6 milliliters per 100 pounds. Do not administer more than 15 milliliters each site. And actually, Beef Quality Assurance says do not do any more than 10 milliliters each site, because you can have muscle damage if you put too much drug in one injection site. So I say 10, even though it says 15. The injection should be given only in the neck, and that's true for food animals. Injection sites other than the neck have not been evaluated. Okay, and then there's their information, and then the lot and expiration number will be down there. And I will show y'all while I'm on it. Here's a vaccine box, okay, for cattle, and this is actually a modified live. So when you open this one up, you're gonna have two different bottles in there. One is gonna be the liquid, one's gonna be the powder, and they've got to be mixed together to become active. But all that information on the label is going to be found on the back of this box, so you guys can see that. And so everything you need to know is on there, as well as on the actual bottle. You can see like the expiration dates on that black tab. Okay, and it's also on this box on the bottom. So one thing that I do when I'm working cattle is when I'm shoot side, I just snap a few pictures of the serial number and the expiration date, what the product is. I jot down the numbers of the animals I give it to. And then when I get back in the house where my records are, then I transfer that information over, even though I've disposed of everything, or maybe I've lost track of which box went with, which 10 head of cattle or that sort of thing. And then this is a killed vaccine, so it's just one bottle. But you can see the expiration date on it right there. You can see that it tells you to give it in the neck of the animal. And then you have all the instructions here. And if you have a hard time reading this, have a magnifying glass or have something, an app that'll blow it up, enlarge it, shoot side. That way you're not guessing, or you don't have anybody there that can help you read it, because it is very small print on some of these bottles. Because when you go buy this bottle in the store, this is all you're getting. So you've got to be able to read that on there. Okay, so let's talk a little bit about livestock health. So for biosecurity, we want to quarantine those new animals. If we find any animals that are sick, we also want to quarantine those away from the group. And the reason being, when you quarantine new animals, you want to observe those animals usually for around 30 days if you can. Some things you see 21 days or 2 weeks. I mean, it just kind of varies, I think, on that farm's protocol, but it's usually up to 30 days. But you want to make sure that that animal's not going to get sick from the stress of being trailered and transition from one farm to another, or that they're not going to give your animals something. So you definitely want to watch them and make sure that they're going to remain healthy. Everything's going to be fine with them. If you find a sick animal, the reason for quarantine that animal is so you can assess that animal, if you need to call a vet out, if you need to do treatment, things like that. And it could be something that's easily spread. So if you go ahead and quarantine that animal and get a handle on it, hopefully it doesn't spread to the rest of your animals. So that's definitely the hope with that. And a lot of times those animals just need close-up or more immediate attention and don't need to be out with the rest of the group, you need to keep a close eye on them. You definitely want to change your clothing and shoes between working on the farm and doing chores, to going to the feed store or going to town. You don't want to take anything from your farm and pass it on to anybody else, but you also don't want to pick up stuff from town and bring it back home. So you want to have different shoes. I know for me, I have a pair of rubber boots that stay on the farm. They never go anywhere else but the farm. And if they do, they're going to get sprayed and cleaned and that sort of thing. But try to have like dedicated chore shoes and dedicated, clothes and shoes for town, or a way to disinfect and clean things in between. Make sure that you clean your equipment. So if you've got hoof trimmers, that's a really good one to think about. You can spread foot rot around, your goats or your sheep, if you don't clean those trimmers in between animals, or if you borrow a pair of trimmers from someone, make sure that you're disinfecting and cleaning equipment. Any equipment that is, if you're using a drench gun, if you're using, combs or clippers or trimmers or, buckets, feed pans, any of that kind of thing, you want to clean it in between uses and clean it between animals. And really, if you can avoid borrowing other people's things, because you might be bringing something else onto your farm, you don't want to pass something into their farm. So just being kind of conscious of these things. If you show animals, you definitely have to be very particular about, stuff that you're bringing to the shows. All of your equipment needs to be cleaned. Your animals need to be quarantined when they come back, and make sure that everything's good to go before you mix them back in. Again, always read the labels, follow them on the feed, medication, vaccines, and dewormer. For animal handling, you want to use low stress handling techniques. You want to understand the flight zone, how those animals move. So if you're not aware of the flight zone, it's basically their little bubble around them. So for just take cattle, for example, you got a cow out in the pasture. When does she start to move? Is it when she first sees you, or is it when you're 5 feet away from her? There's some cows, if they even get a whiff of a person in the area, they're going to take off running for the hills. And there's other cows you can walk right up to and pet them. So most cows are in between, but it's just kind of their bubble around them. And so how do you get them to move? And if you don't know how that works, the best thing to do is just go practice with your animals that you have, or find somebody with animals and just get out there and kind of walk around them and see how they move and how they turn around and look at you. Most animals do have a pretty good blind spot right directly behind them. So you want to kind of stay off to the side so they can see you and you can move them forward, or if you need to turn them around. Animal appearance, you want to check for signs of a sick animal. So, really get familiar with what a healthy animal looks like. They have bright eyes, their head's up, they're walking around, they're eating, they feel good, they're aware, they're paying attention to you. If they're sick, they're going to have a dull hair coat, they're going to have diarrhea, sunken eyes, their head's going to be lower, they'll be off feed and water. They really won't care what's going on around them. They'll probably be off by themselves. So you definitely want to check your animals every single day, make sure everybody's good and that there's no issues. And this time of year, you definitely want to be looking at eyes in case one starts to get pink eye. So there's certain things you're looking for all the time, certain things that could be seasonal, to make sure that they're doing okay. So your veterinary relationship, you want to always work with a veterinarian to establish that client-patient relationship I talked about. You want to have a good herd health program in place. And what that involves is, what's healthy for your herd, what issues have you had, and how can you overcome that and be proactive. So most herd health programs are going to involve, what is your vaccines, your dewormer, what's your disease concern, what's your biosecurity plan, your parasite plan, for internal and external parasites. So it's going to kind of include everything to have a healthy herd and be as proactive as possible, and be aware of the potential issues you could have. So cleanliness, again, you want to keep everything clean. So your feeders, your waters, your trailer, your pens, everything needs to be clean, and especially clean out uses, you know, in between animals or when you're hauling the trailer, things like that. Okay, so moving along to record keeping. These are just some things to think about when you're doing your records, whether you do them hard copy, like you've got a sheet of paper and you're writing everything down on these animals, or you're doing an Excel sheet, which I find very helpful and easy to do, or you're doing an app, or you have an online software that you're using. I recently started using an app for my cattle, and I really like it because I always have my phone on me, and if I need info, I can get it real quick, and it's easier to read fast than a spreadsheet is on my phone. So but I think it's good to do a couple of different things in case your phone happens to crash or your computer crashes and you can't get your records off. So I always recommend doing at least some hard copy record keeping in a notebook, and then some maybe in electronic form. So you want to know their identification. Every animal needs an ID. This is so important from a record keeping standpoint, but also just for accountability. If you go out there and you realize you're missing one, you know, if you look through there, you can quickly figure that out if you've got tags. But if you've got 50 Black Angus cows that all look the same, and you don't have any clue to figure out which one's actually missing. So it's important to ID those animals. Having a birth date on them is definitely very helpful. If you don't, most veterinarians can help you age them. So you've at least got an idea of how old they are. The dam, the sire, you know, any bloodlines, of course, you don't have to have that information, but it is helpful, especially if you're doing registered animals or seed stock type animals. Health, any vaccines, dewormer, medications giving, what's their breeding and offspring. So, you know, this animal was bred on this date, so we expect, you know, piglets on this date. So making sure you've got all that information so that you're ready and you're feeding that animal accordingly, and you've got everything set up for that animal to farrow. Knowing their weight is important, because if you ever have to treat that animal, you really need to know their weight. Especially if you have to do like an antibiotic or something like that. But it's also good to know what's normal for that animal. So if they start, you know, losing weight or gaining weight or things like that. And then if you're also growing an animal, it's important to know what's their average daily gain, you know, so how are they doing? Are they gaining 2 pounds a day, 4 pounds a day? And the only way to know that is keeping track of their weight. And that kind of falls into that other category, the average daily gain. But pasture rotation is another one. Any costs associated. There's lots of other records that you can certainly keep. Okay, so let's talk a little bit about ear notching. So ear notching is a permanent form of identification. There's two types. There's either temporary identification, like an ear tag, or something more permanent, like ear notching or a brand. So ear notching is a universal system. So if you learn how to read ear notches, you can do it anywhere at any time on pigs. Their left ear is going to be their pig number. So this is the pig's left ear. And the right ear is going to be the litter number. Okay, so you can see where the notches would go for whatever number. So if that pig's number was a 10, it's going to have a notch here and a notch down here, and that you add those numbers to get 10. Usually the litter numbers are, you know, they're going to be lower numbers versus the pig numbers. The individual pig numbers are going to be a lower number because there's only X amount of pigs that can be born in that litter. However, the litter number can get up high because that sow farm might have, you know, 100 sows or 1,000 sows or something like that. So it can get on high, get on up there in numbers. So that's why you have 81 as the tip of the ear there. So you've got all these different number combos to make that litter number. And this is kind of how it works and what it's going to look like on a quality assurance or a Skillathon test. So they might ask you to ear notch that pig for 38-4. So 38 is going to be the litter number. If you remember me saying, the litter number is usually going to be the higher number, and then the pig number is going to be the lower number. So on this particular pig, this is what it would look like to do a 38. You're going to do 1 and 1, and then a 9, and then a 27. And then to get the number 4, you're going to do a 1 and a 3. So that's what it'll look like. So they can do that. They can say, okay, draw in the marks for 38-4, or they can have that pig marked and ask you what is the litter number and the pig number. Okay, so here's another one. This is 87-12. You can kind of see what that looks like. So this is something you just have to practice. One thing that I think is fun to do is to actually get a paper plate, and you can draw a pig's face on it and draw the ears, and then you can take scissors and you can make yourself a key, you know, based off of this right here. Make yourself a key and you study it, and then you can start making other paper plates based off of numbers that you want to practice. And it's just kind of a fun, very visual way of doing it if you like doing like arts and crafts type projects. There's lots of worksheets out there that you can find, just Googling ear notching, you know, activity worksheets that you can practice this at home. Okay, so let's talk about administering injections. So all products should be administered following the label directions regarding dose and route of administration. So the quality assurance guidelines prefer injections to be given subcutaneous and in the neck. So for Skillathon or quality assurance, you might be asked to fill out a chart, for example, on the different routes of administration. So you need to know what these terms mean, what the abbreviations mean. So definitely study this information. So intramuscular, the abbreviation's IM, and it means in the muscle. And even if something's routed for intramuscular, you still want to give it in the neck. Subcutaneous, you can abbreviate it sub-Q or SQ, and that means under the skin, and that is the preferred method. Intravenous or IV is in the vein. Oral, the abbreviation's PO, and that's through the mouth. And there's intranasal or insufflation through the nose into the nasal passage. And I'm not aware of an abbreviation for that, but there might be one out there. Okay, so for as an example for beef quality assurance, proper injection site. So this is kind of their little graphic that they use quite a bit. It used to be, back in the day, a lot of injections were given in the rump, and they recognized that that was a pretty big problem. And that was one of the reasons that the beef quality assurance program got started, is they're like, hey, we can turn this around and we can get, you know, we can educate producers and get them to inject in the neck. And that's been the biggest success story out of the beef quality assurance program, along with so many other things. But I cannot remember what the percentage was starting out, but it was quite a bit. You know, rounds coming out of the rump of the cow had injection site lesions, down to today where it's almost non-existent. But it still can be a problem, but it's nothing like it used to be. So you definitely want to inject in this triangle right here. You want to follow the label, use good restraint. So use a head gate or squeeze chute, use clean needles and syringes, and don't use outdated products, and don't inject in the rear. I will say this, the dairy industry has made great strides as well, because they were, it was just very convenient, easy for them to give injections, I feel like, in the rump, because that's where they're at on the cow all the time, milking the cow. And that's just where it was easy to give injections. But through a lot of education and the quality assurance programs, they have made great strides in changing what they're doing, because ultimately those dairy cows are going for beef. So they're now given injections where they need to be. Okay, so if you've never seen injection site lesion, this is what it looks like. It's definitely not something that I want to eat, and I'm sure you don't either. So when this happens, you know, in a processing plant, they've got to shut down the fabrication line. They've got to clean it. They've got to cut, you know, any of those muscle areas out, or those injection site lesions out. They lose money on that carcass. They lose money in labor and time and everything. So it's not good for anybody for that to happen. It's definitely not good for our industry and from a profitability standpoint. So a lot of this does happen, I feel like, in the cow-calf sector, and we can definitely, you know, stop it there, and that way it doesn't become an issue down the line when they're processed. So when you administer injections, you want to change the needles every 10 animals at a minimum. Honestly, I prefer after each use. And if you talk to veterinarians, they're probably going to recommend that just from a biosecurity standpoint, so that you don't spread any kind of bloodborne disease or things like that. And needles are really cheap. I mean, for the most part, they're like 10 to 15 cents or so each. They're real cheap. I think it's extra insurance and worth it. But if you need to go multiple animals, you don't want to go over more than 10. Never use a bent needle or a dirty needle. Keep product at correct temperature when storing and administering. So if you've got a vaccine that needs to be refrigerated, when you go shoot side, you need to have it in a cooler with an ice pack and keep it cool the whole time that you're giving those injections. Keep no more than 10 cc's in injection site. Again, you can have muscle reaction or muscle damage. Do not transfer needle from animal back to injection bottle. Either use a transfer needle or a new needle. So that's why I say, again, use a new needle in between animals. Then you don't have to worry about keeping a needle in the bottle and switching, you know, changing your syringe and that sort of thing, or using that transfer needle. Disposable syringes are recommended over multi-dose syringes. Disposable syringes are more accurate. They do not have to be cleaned. You can just throw away and get another one. And again, they're really inexpensive. So I've got some to show. This is a multi-dose syringe. So if you see this for Skillathon, that's what it is. You can set up on the top. Do you want it to give 3 cc's? I think this one does 1, 3, and 5. Actually, 1, 2, 3, 4, 5. Yeah, 1, 2, 3, 4, 5. So you set it. You've got to make sure that it's actually delivering what you're setting it at. It can hold up to 50 cc's. If you're vaccinating, you know, 200 head of cattle, this is going to be the way to go, because it would wear you out doing an individual draw for every single animal. But you want to make sure that these are cleaned properly, that they're given the accurate dose. I think another term for this would be a pistol grip syringe as well. There's a couple of different terms, but it's multi-dose or pistol grip syringe. Some disposable syringes. So this is one right here. This one does up to 35 cc's. This would probably be used if you're giving some kind of medication or antibiotic. Vaccines are normally a very small amount. This is probably the size that you're going to use for vaccines a lot, up to a 10. This holds 6 cc's. And most vaccines are going to be like 2 to 5 cc's per animal or so. So these are pretty nice. And then here are some needles, just so you can kind of see what that looks like. Let me take that off. So we're going to have a cap. And you want to make sure that everything stays capped. While you're walking up to give that injection, you're going to give the injection and you're going to cap it right back. Don't walk around with the needle exposed, because that's a great way to get hurt shoot side. But there's definitely different needle sizes. So I had a couple of different ones. They're going to depend on the diameter and the length. So for sub-Q injections, you really want 3/4 to an inch. And then for intramuscular, 1 inch to 1.5 inches. So you're going to have to actually go into the muscle. And so I'm actually going to show y'all a video that's going to talk more about needle size here in a minute. And I do have one last tool in here before I forget to show it to y'all. This is a pour-on applicator gun. If you've never seen one of these, they have a long tube that goes into the pour-on bottle, and you set a dial on top. You can see that dial right there, and you'll set that based on their weight. So it's got a little chart on it, and you'll squeeze the trigger, and you'll put this along their back for pour-on. So this one in particular is for cattle. Okay, so that's the end of that. So we are going to look at a video. And I will say, if you're not familiar with the videos that I have been putting out, they can be found at our Alamance County CES. And these are all the beef quality assurance videos that I have put out, but I've also released videos on hay sampling and pasture rotation and fecal egg counting and lots of other educational videos. So you're welcome to, find us on YouTube and check out those videos. But let's watch this one on giving injections. And I'm going to play a little bit of it. And if you can hear it, give me a thumbs up. I shall make sure everything's working. There's a few things you need to know before you give your first injection. According to the Beef Quality Assurance Guidelines, all injections should be given in the neck region of the animal, unless otherwise stated on the label. There are two main ways of giving injections: subcutaneously, which means giving an injection under the skin, and intramuscularly, which means giving an injection in the muscle. You should give injections subcutaneously if at all possible. For subcutaneous injections, you want a needle gauge of 16 to 18, and a needle length is 3/4 to 1 inch long. For intramuscular injections, you want a needle gauge that's 16 to 20 and a needle length that is 1 to 1.5 inches long. You want to give no more than 10 cc's at any injection site because it can cause muscle damage. And you want to separate your injections by 4 inches or 1 hand. A couple of other tips. If you're out in the market shopping for a new squeeze chute, check one out that has injection site doors. That makes it a whole lot easier to get to the neck of the animal. A few other tips. There's two different methods to giving injections. One is called the tent method. So you take one hand, you pull up the skin, and the other hand is going to hold the syringe to give the injection right underneath the skin. The other method is using one hand. And so with that hand, you're going to ease the needle up underneath the skin, and once you feel it pop through the skin, then you will inject the drug or the vaccine. You also want to make sure that you don't inject in the neck of the animal when it has manure on it. So you want to make sure that you are injecting in a clean area. Also, you want to make sure that you are changing needles every 10 head or less. I personally recommend that you change needles out for every single animal to minimize the spread of disease. You also want to make sure that you change needles if they get bent or burred so that they don't break off. Another helpful tip when you're picking out your syringes: disposable syringes are preferred over multi-dose syringes. That's because they are very accurate and you don't have to worry about misdosing. And you also do not have to worry about cleaning the syringe. Those are a few tips according to the Beef Quality Assurance Guidelines. Okay, does anybody have any questions so far before we do kind of the final leg of the practice and do some Kahoot questions to see what you've learned? Anybody have any questions? Okay, and one thing that I did not say or have in my PowerPoint that's super important is understand that 1 cc equals 1 milliliter, okay? So when you're asked to do math questions or things like that, you definitely need to know that they equal each other. So 1 cc equals 1 ml, okay? All right, so if you'll get your iPhone or iPad or other device, other laptop, something else out, if you have it, to connect to the Kahoot. If you don't, just, like I say, play along, either with a piece of paper or something like that. Let's see. Okay, so you just join at kahoot.it and you put in the game PIN and then plug in your name. And let's see how many people I'm looking for. Roughly 8. Okay. Let me know in the chat window if you're not able to get on with another device. I'm gonna give it about another minute and then we're gonna go ahead and start. So like I said, let me know in the chat window if you're not gonna participate. So I'm not looking for you to join in. Y'all's names are interesting. Okay, here we go. There's 14 questions. Okay, good job. So this is part of knowing normal versus not normal information for each species. Okay, so there was the vast majority of y'all knew that that was a normal temp, so you don't do anything. Definitely know your temperatures for each of the species. Okay, so for cattle, you know, you can castrate them as early as when they're born. For BQA guidelines, you need to castrate them at 3 months or less. So 3 months is that threshold to follow BQA guidelines. And I would say most species, you're going to want to try to castrate them at birth just to minimize stress later on. So if you're able to do it, that's the earliest that you can do it. Okay, good job. I think I keep forgetting to go in and edit this. I think I had the same question twice, just maybe worded a little bit differently. So I apologize about that. I've been meaning to fix that. Okay, good job. Good job. I know that wasn't necessarily taught today, but I think the take-home message is you definitely need to know your diseases, not only from a quality assurance standpoint, but definitely from a Skillathon standpoint as well, because you will be asked different questions on the different diseases. All right, that's lepto. Good job. Okay, good job. Okay, so the biggest thing with most any herd animal is that you definitely don't want to try to single them out because they tend to panic and act up worse than they would normally. So you definitely want to be as calm as possible while putting them in a holding pen, and do it in small groups, even if that means two-headed animals. But don't try to sort them out one at a time if you can help it. You definitely don't want to shout and run and poke at them. You don't want to shout and wave your arms. The only thing I will say is if your animals don't have any kind of flight zone, it can be hard to get them to move. So you might have to have some kind of sorting tool, you know, a flag or something like that to help move them along, because they're not going to move off. They're not going to move away from you if they're not bothered by you at all or don't have a flight zone. So those are some things to think about, especially with show animals. Okay, so if you haven't heard of antibiotic resistance, it's definitely a huge problem, and that comes from just mass treating animals, even if a particular animal doesn't need it. So that's where this question comes into play. According to quality assurance guidelines, you do want to treat the fewest number of animals possible. So what does that mean? That means figuring out which animal actually needs to be treated versus treating an entire herd or an entire group. So if there's only one animal showing signs of having, you know, a disease or foot rot, for example, or something like that, you would want to get that particular animal up and give that animal antibiotics versus treating the entire herd when they don't need it. That's what can create resistance, is using product, you know, not according to the label, animals that don't have symptoms, things like that, or overusing the product. So it's a tool in our toolbox, and it needs to be used very responsibly, especially given the current situation that we're in with antibiotic resistance and the concern with antibiotics that are used for animals versus ones that are used with people. There's just a lot of attention around antibiotics, so we want to be very responsible when we use them. All right, last question. Okay, some of y'all were paying attention. Good job. So you have up until 3 months of age to get any kind of processing done under Beef Quality Assurance Guidelines or BQA. So good job. Let's see how y'all did. Hold on one second. Okay, awesome. That's the end of practice. I know we're ending a little bit early. I wasn't quite sure how much time that would take, and I didn't want to have to cram too much in the 1 hour. So if you've got any questions, I'll be happy to answer any questions about what you learned today or anything related to quality assurance, Skillathon, Quiz Bowl, any of that sort of stuff. Anybody have any questions for me? Okay, well, if there's no questions, that's the end of practice. I hope you guys have learned a little bit about quality assurance, and you know, you're gonna hopefully do better on your next Skillathon test. All right, thank y'all for having me on today. Have a great afternoon.